Yeah, I mean, I definitely think that there are a percentage of kids that have timid temperaments. I would say like 80 to 90% of our families have that underlying diagnosis of a social anxiety in addition to SM. So for those families, there is quote unquote some shyness that's occurring where building up some of those comfort skills allows them to move more into communication, whether that's verbal communication, using a parent as a verbal intermediary, or even nonverbal, doing more hand over takeover engagements. But like Dr. E is saying, I definitely think there's a large chunk of our families that we work with, if not all of them, where, yeah, there could be some shyness that's occurring, but there's so much more beyond that surface. And I think that's where we differentiate a lot of that, within our treatment is uncovering really those whys of SM. I know we've talked about this in other podcasts as well, but we really do dive deep into those underlying whys. We see SM as a result of, we don't see SM causing anything. So it's not just get comfortable, get our child to speak, but rather what is making them shut down in those moments and how can we move forward from that. So we actually uncover those underlying whys, and that's actually exactly what we work with and what we quote unquote treat, right? We don't treat to speak, we treat the person. And so when we figure out those underlying whys, it makes it that much better and more, it makes the treatment plan more comprehensive and allows us to feel more confident in that approach.
No, really well said. And I think one of the problems with it's just shyness is that it frustrates parents, it frustrates teachers, and most importantly, it really frustrates and often causes shame, avoidance, more anxiety, depression as kids get older because they're very misunderstood. And when that approach is, let's get them to talk without understanding, which is why for us, that selective mutism eval, and I'm sure a lot of other clinicians have similar types of evals, where the goal is to conceptualize, to understand that child, that teen, that adult. What is it about them? Like, who are they? What are the stages in each setting? What are their underlying whys that are causing this child to have difficulty speaking? Like, you could have a child respond one or two words. They're not elaborative. They're not initiative. You could have kids that are constantly taking a delay in their response. These are kids that sometimes, you have challenges with academics. They don't have challenges at home, or they do. It's about understanding them and what do we need to think about. And this series is going to go into that. It's going to break down the different segments of more than shyness when there's additional challenges. But today I want to talk about when additional testing may be needed to kind of dive deeper than the selective mutism eval. And I do want to mention that a really big part of working with kids with SM is how are these kids performing at school? The selective mutism assessments out there often focus on where they're speaking, where they're not speaking, who they're speaking to. But to me, that's like stage 3. What are their stages in other settings? That's why we use the social communication anxiety inventory that breaks it down into the bridge and the different stages. But a big part of our evaluation is what are these kids like at school? Are they starting, completing work on time? Are they below, at, above grade level? Do they have difficulty? Do they hesitate? Are they a behavioral challenge in school? What is their social communication like with peers one-on-one, with teachers one-on-one, in groups, large and small? Really deciphering what are these kids like in school? And then what are these kids like at home? Because some of these children who have issues at home and school have other underlying challenges that so many people think they're separate than SM. But what they don't realize are those are the factors. So talk to us. I mean, just this week alone, I know we've talked about cases you've had of cases of kids that they've missed the diagnosis. They've missed the more than shyness and frustration that exists with teachers during school consults. This kid's being defiant. This kid's being difficult. Like, why aren't they talking? I saw them talking to their family at home, or in the parking lot, rather, like in school when those demands are higher. Talk to me about that. Talk to me about some of the clients you're seeing.
Yeah, well, I think that you bring up a really good point about assessing further in schools because I think many times teachers are feeling that the selective mutism is causing a lot of these other challenges. And so when, treating to quote unquote speak is that mentality, they're not really focusing on those underlying aspects of like, well, why are they hesitating with their work? Why is it that they're constantly looking at their friends' papers before they initially start their task? Why is it that they're, having trouble attending to various aspects in the room? Why is it that they're getting distracted, right? So there's a lot of components that are going on, and I do think that, like Dr. E said, we need to assess what's going on in the home environment as well, because there are many individuals that, as we know with selective mutism, based on the setting or based on the person that they're with, it could change their level of communication, right? Their stage of communication. But there are many different individuals that, from a behavioral standpoint, you're still seeing some of those commonalities in different environments and with all different people. So if that's the case, like if you're noticing, for example, like if we keep to that trend of the attending or having trouble initiating tasks, having trouble planning and organizing their thoughts, if you're seeing that at home, let's say you're a parent who's noticing, oh, when I do homework with my 7-year-old child, and every time we sit down, they're still having this trouble, right? And there's no social communication challenge at that point because they're completely comfortable in home. There's probably something else going on in terms of what that underlying why is. And it could be, again, maybe there's a relative over or a friend over that's causing some of that trouble. But if you're just in your natural habitat and your child has no anxiety present and you're still seeing those underlying challenges, that is when we would further recommend that further testing, which whether that's ADHD testing, if there's underlying processing or learning challenges, doing more of our, what we call our fuller batteries, where we do like psychoeducational testing and figuring out more of their academic and cognitive baseline. There's so much more that we could expand on. We do a lot of autism testing if we're seeing a lot of those social challenges in all aspects, not just from a aspect of trouble, with social communication, but if you're noticing even in the home environment having more difficulty with reciprocity, your child not always coming up and asking you a question, or your child having more of these restricted interests, at home, and you trying to shift a task and they're just so preoccupied, if there's aspects to their social communication that you notice those nuanced oddities even in the home environment, right? That's when we would recommend that further testing. So it's not just when they're in their uncomfortable environment, let's do that testing, but rather when we're trying to figure things out and there's still that kind of diagnostic question mark even in the home environment, it's so beneficial to do that.
No, these are good points. And as we know, when we talk about selective mutism, 30 to 40% of kids have underlying speech and language issues, but they're going to have those issues at home. It may be not as common at home or less obvious because the language is so kind of typical. Whereas in school, when the language is more deconceptualized, it's more trying to put thoughts together and say it and answer questions they're not thinking about. It's much more difficult. It becomes much more obvious, especially if they have other anxieties. So I think that's important too, because we need to know what's happening in the home and school to be able to say, is this anxiety causing some of these difficulties? Because anxiety can cause receptive and expressive language difficulties in terms of like not a true difficulty, but almost appearing that way. It can cause a child to look inattentive. It could cause a child to be avoidant and not start and complete work on time. It could cause a child to have behavioral difficulties, like it's more of a generalized anxiety or other anxieties. So it's really important to understand that. I think that what I would like to talk about is when it is more than just shyness, when do you kind of think about that? And I think for me, what I think about is the child is pretty stuck. The typical get the kid comfortable, ask them some choice questions, use some visuals, pair them with buddies, have some play dates. It's just not moving quickly.
Mm-hmm.
The child is more stagnant. Of course, if you've got that treat to speak and the child is in the nonverbal or non-communicative and they're not ready to speak, it could certainly, exacerbate these difficulties and anxiety because that treat to speak philosophy does not work for me unless they're verbal and you can really talk about talking when the child's ready to talk about talking. Right. So the bridge for us, to me, is all the stages. Children feel relieved when they realize, wow, I am on the bridge. I can do this, rather than all that I can't do, and which is why the social communication anxiety inventory, and we welcome clinicians. It's on our resource page to utilize the bridge, because I can say with, full certainty that kids are not just mute and that there are stages of social communication, and respecting that gives the children a sense of control. It also is a huge relief. And we see that at camp. We see that with parents at camp.